What are actionable genetic mutations for breast cancer? Imagine unlocking a secret code inside your cells that can tell doctors how best to treat your breast cancer. That's what genetic testing aims to do by identifying specific mutations in your tumor. Some of these genetic changes are called actionable mutations because they guide targeted treatments that can be more effective and personalized. One of the most well-known mutations involves the BRCA1 and BRCA2 genes. These genes normally help repair DNA damage, keeping cells healthy. When they mutate, the risk of developing breast cancer increases significantly. If a tumor has a BRCA mutation, doctors might recommend using PARP inhibitors, which block alternative DNA repair pathways, leading to cancer cell death. These drugs are approved for treating breast cancers with BRCA mutations, regardless of hormone receptor status. Another key mutation is in the PIK3CA gene, which is involved in a pathway that promotes cell growth and survival. Mutations here are common, especially in hormone receptor-positive breast cancers. If testing shows a PIK3CA mutation, a patient might benefit from drugs called pi3 Kelvin inhibitors, like alpelisib, which are FDA approved for certain types of metastatic breast cancer with this mutation. Mutations in the TP53 gene are also common, especially in triple-negative breast cancers. While there are no direct targeted therapies for TP53 mutations yet, knowing about them helps with understanding prognosis and potential responses to treatment. Mutations in the AKT1 gene, part of the same growth pathway, can also be targeted with specific inhibitors. These mutations tend to occur more often in luminal breast cancers, which are hormone receptor positive. HER2, also known as ERB2, is a gene that, when amplified or mutated, leads to HER2-positive breast cancer. This type responds well to targeted therapies like trastuzumab and pertuzumab, which specifically attack the HER2 protein. Some mutations in ERB2 can influence how well these drugs work or whether resistance might develop. Alterations in genes that control the cell cycle, such as CDKN2A and RB1, are also important. Changes in CDKN2A may make tumors more responsive to CDK4/6 inhibitors, which help slow down cancer growth. Mutations in RB1 are more common in triple-negative breast cancers and can affect how tumors respond to certain treatments. PTN is another tumor suppressor gene that, when lost or mutated, can influence how the cancer behaves, especially in triple-negative cases. PTN mutations may affect sensitivity to pi3 Kelvin AKT-mTOR inhibitors, which are drugs targeting that growth pathway. Other genes like NF1, ERB3, KRAS, NRAs, and those involved in DNA repair, such as PALB2, rad 51 degrees Celsius, CHEK2, and ATM, are also being studied for their roles in guiding treatment options. For example, mutations in DNA repair genes can make tumors more responsive to PARP inhibitors or immunotherapy. Identifying these mutations through genetic testing helps doctors choose the best treatment options. For example, if a tumor has a BRCA mutation, PARP inhibitors might be a good choice. If PIK3CA is mutated, a pi3 Kelvin inhibitor could be effective. If HER2 is overactive, targeted therapies like trastuzumab are used. Testing also helps predict how tumors might resist certain treatments, allowing for more personalized care. It's important to remember that genetic testing is especially recommended for patients with advanced disease, triple-negative breast cancer, or a family history of hereditary cancer syndromes. This approach, known as precision medicine, aims to match each patient with the therapies most likely to work based on their tumor's unique genetic profile. In summary, actionable genetic mutations in breast cancer include changes in BRCA1 and BRCA2, PIK3CA, TP53, AKT1, ERB2, CDKN2A, RB1, PTN, and other DNA repair genes. Finding these mutations helps guide targeted treatments, improve prognosis, and tailor care to each individual. Always consult healthcare professionals for personalized advice and treatment options based on your specific situation.